So now it's my pleasure to introduce our two authors of today's session, Sheryl Reimer-Kirkham and Sonya Sharma. Sheryl Reimer-Kirkham is Professor and Dean of Nursing at Trinity Western University in British Columbia. Her research is in the area of plurality and equity in healthcare, focusing on the intersections of religion, spirituality, race, class, and gender. She is a co-author of the book Religion, Religious Ethics, and Nursing, and is the lead author of the book Prayer's Transgression, The Social Relations of Prayer in Healthcare, published in 2020 by McGill-Queens University Press. This book is, of course, also serving as the focus of our discussion today, and is co-authored by Sonya Sharma, as well as Rachel D. Brown and Melania Calistani. It is also based on a research project led by Sheryl of the same name. Sheryl is also the lead on the Mothering and Albinism project and is a collaborator of the Nonreligion in a Complex Future project. Sonya Sharma is Associate Professor of Sociology at Kingston University London. Her research takes an interdisciplinary and feminist approach to investigating religion, spirituality, and inequalities in healthcare settings. She was a co-investigator of the Prayer's Transgression research project and the project lead for Living Well Together, Learning from Women Healthcare Chaplains About Religion, Gender, and Human Flourishing, which address the invisibility and significance of women healthcare chaplains' work. In addition to being a co-author of Prayer's Transgression, Sonya is co-editor of Religion, Equalities and Inequalities, and the author of Good Girls, Good Sex, Women Talk About Church and Sexuality. So Sheryl and Sonya, thank you so much both for being here today. And now without further ado, I will turn things over to you.
Great. Well, thanks so much for the invitation and for hosting us at the Meet the Author seminar. And I've been looking forward to this and would love to be there in person. It's starting to really miss not having the in-person conversations. I am joining you, though, from the beautiful traditional unceded Stolo territory. Stolo refers to people of the river, and our zone is south of the Fraser River, and it's a really beautiful place. Very grateful to be on these lands. We're talking about a study that we've enthused about for years, and it really has been one of my most, well, I always say this about all my research. I always say this is my favorite project, and then the next one comes in, and that's my favorite project. So I do love this project in particular has been pretty amazing, and it's been unique in some ways. I think when we do research in the context of healthcare settings, we're entering into these very intimate spaces, and so there has been a very sort of a profound, intimate beauty to lots of the project. And during the pandemic, while we managed to get the data collected before the pandemic, it really, I think, I've thought about this project so often during the pandemic, and I've thought about, how are those nurses doing? How are those chaplains doing? How are patients doing in, I can exactly see the room. How are they doing in that room? So it really has been quite remarkable, both looking back at the project. And I think a lot of like we wrote in the preface, I think a lot of our findings we do believe there's a continuity to the findings. And as we know, with the pandemic, we have had really, it's been the amplification of everyday life in a sense. And so I think that much of what the findings are, I think, will be amplified during the pandemic. So I'm going to put up a couple of slides, if you can just kind of indulge me with that. I think those are there, and I'll just mix them. So how Sonya and I are going to go ahead is I'm going to do some of the talking about the project and the methodology, and Sonya is going to pick up on some of the certain angles on the findings that we think you'll find interesting. So the team of scholars for the project, I want to also try to highlight some of the things that might be unique or unusual about the project as we go along. So we're had this team of scholars and practitioners really on the project, and I think that's kind of cool to have done this kind of research in a team approach. And the interdisciplinarity of the study, I think, will really show through as we talk through some of the findings. I want to acknowledge the 109 participants that spoke with us during the project, and very grateful for the organizations that supported the funding project, including funding from SSHRC, and appreciated, of course, the work with McGill-Queens. I think McGill-Queens were able to see they were able to honor the intent of the book project, in that we wanted to have a book that read like a coherent whole based off of one project, but still having individual author contributions. And so the one thing they couldn't do for us, we wanted to actually have all of the contributors listed on the front page, on the title, on the cover. They ended up just having 4 of us on the cover. We actually saw it as all of us needed to be listed to reflect everybody's contribution, but they weren't quite ready to go there. What I do want to say also is that so I think I'll leave it at that on that point. So there's our team. So fantastic team. We worked as a team in that there was a core of us that were doing the data collection and the analysis. We got together only once in person with the whole team, and this was in Vancouver in the fall. September of 2017 was the one time we got together, all of us, and we had then went through a process of writing the chapters and reading each other's chapters. So we really can say that everybody's eye was on everybody's chapter, even though there's 3 authors for most of the chapters, but we actually all read everybody else's chapters and gave feedback on it. And so that was also a very good process as far as working through the findings. So as signaled by the book cover, our idea was to use prayer as a window to look through to understand how religion and non-religion are expressed in public spaces, and in this case, the public space of healthcare. Healthcare settings are very complex social systems, microcosms really of broader society, where agreement, ambivalence, and conflict coincide. Healthcare settings offer insights into how majoritarian religions continue to keep a foothold while in a declining way, and how new spaces are opened up for diasporic religions and indigenous spiritualities, as well as how non-religion can be both dominant. It's very interesting dynamics. Non-religion can be dominant through science and biomedicine, and marginalized at the same time, for example, when patients might request spiritual practices that are not well understood. While our project, as I said, occurred prior to the pandemic, we are sensitive to what might be the same and what might be different. There was a study done 2020, you'll be familiar with, Benson out of Copenhagen, showed there was such a spike in Google searches for prayer in the first months of the pandemic. And I think that this light has been shed on spiritual pain suffering amongst healthcare staff during that. There's been some attention to healthcare staff, including the invisible labor of porters, morticians, cleaners, cafeteria staff. So we really are tuned to what could be the same and what could be different. About the study itself, so we used a method, we referred to it as critical ethnography, but I think we threw in a few twists that worked out well for us. We used a primary sample, which were the spiritual care practitioners, who we do end up referring to as chaplains. And then we write a little bit about why we chose the term chaplain rather than, in Canada, this group of professionals is usually referred to as either spiritual health practitioners is our British Columbia term, or spiritual care practitioners. But in London, it was more, they were considered chaplains. And the field of study is referred to as chaplaincy studies. And so that's also why we ended up using the term. In the book, we refer to chaplains. But in this primary sample, we had 44 spiritual care practitioners who worked with us. And we had a series of 3 interviews, and to meet with them repeatedly was really fantastic in developing relationship, getting to know them, got them really thinking about the project. And this usually happened over about 6 weeks. We'd work with each one, and they would come back to us with new stories, and they'd say, hey, I was thinking about this. The first interview was usually in their work setting, but we wouldn't go into the clinical areas. So we just met with them in their work, in their office usually. And then the second interview, we asked them to take us to places in their, whether it was a hospital or a clinic or a long-term care setting, we asked them to take us to places that were meaningful for them and areas to tell us stories about where prayer occurred. And those were absolutely my favorite interviews of all time, to be able to walk and talk with them. And very interesting places they took us to. So we can talk about that if you want to. And then at the same time, we asked them to keep research diaries for us. And so they wrote entries. Some of these entries are posted actually on our blog for the project. Prayer as Transgression is the blog tag. And so they wrote poems for us, they wrote stories, they wrote narratives. And so that was pretty meaningful to have them engaged in that way. Then the rest of the participants, we had administrators, and we had pretty even numbers. You'll see the demographic table in the book, pretty even numbers between London and Vancouver administrators. And these could be the CEOs of the organization, or they could be frontline managers. So we have quite a range in that. Then we had staff, so that's a variety of chaplains. Sorry, the staff group is the physicians, the social workers, the nurses, the allied health professionals, so the physiotherapists. I don't think we had nutrition, but quite a range. And then the citizens, and so this was tricky. So we wanted to speak with patients. So for starters, right off the get-go, getting access to do research in healthcare settings is complicated. The research ethics process, rightly so, is a big deal to get through. And it's easier to get access to administrators, healthcare staff, the chaplains, but to get access to patients is actually quite difficult, and again, rightly so. Especially it's health researchers obviously all the time do research with patients, but in this kind of research, we decided to interview family members and former patients, and so that's who's in the category of citizens. And we had, and that was a single interview with them. And then we ran at the same time, we had practice advisory in each site where we asked them to just give us suggestions about what kind of research questions we might ask in our interviews, what kind of questions were confusing to them or they thought we might be able to sift out with our data collection process. And then we also brought our findings back to them and said, does this make sense? What else would you like us to highlight? And so that concurrent practice advisory group was also actually a strong source of data in a sense for us. So I've said that we were in Vancouver and London. Early on, somebody asked us, well, were you doing a comparative study? And I actually still am clear if we didn't set it out to contrast the two sites, but we were able to tease out some pretty interesting comparisons between the two, some interesting differences. We can come back to those as well. But they turned out to be two, I think, pretty neat places to do the sites. They both have strong non-religious, large numbers of nuns, and so that was important. Both of the sites do have a lot of diversity, both ethnic diversity, religious diversity, so very rich in that regard. I chose these two pictures for the slides as we started to tease out, hey, Sonya, about what we asked ourselves the question at one point, how would you describe the spirituality of the place? And in Vancouver, absolutely a very ecological spirituality. And people talked all the time, when you're wanting to get away and do something that's meaningful, what do? Absolutely, into the mountains, by the ocean. And in London, the same question, what do you do when you want to sort of have a meaningful time to recharge in that sense? And it was into the museums, into the art galleries, walk along the Thames. And so we were able to do some interesting contrast that way. And also, I think that was helpful for our study to understand what was going on is the fact that they do have similar publicly funded and administered healthcare systems. And in both cases, hospital systems with spiritual care departments. And so those were good reasons for us to use these two cities, besides the fact that that's where we live. And so we had relationships. So I think that's some of the behind the scenes of the data. I can very happy to talk more about that. In this slide, then, this is some of the behind the scenes. This is one of the rooms where we were taken. And a chaplain took me to this area and they said, when I said, right out, like, take me to a place where prayer happened. And she took me here and she said, well, this is the area before where people are waiting for surgery. And she told the story, and we write it early in the book, where somebody was going for surgery and they stopped the whole machinery. It's a big deal to stop the machinery of the surgical department. And they said, nope, not going into through those OR doors until somebody comes to pray with me before I go in. And she talked about what was like. And that really captured for us this idea of how prayer can be very transgressive. It can really transgress the machinery of the healthcare system. So our project was looking at how prayer is manifest, whether embraced, tolerated, or resisted in healthcare settings. And with that, then we're looking at this idea of prayer as transgressive. We did enter the project. This was with an open definition of prayer, but it was a lot of conversation, ongoing conversation with the team, as you can imagine. And so I just want to read a section at the top of page 22 about the work of trying to keep an open definition of prayer. We wanted to be, and I think we were pretty good at managing an inductive approach, lived religion, inductive approach. How did our participants understand prayer and basically follow their lead in understanding prayer? So we were cautious about being impositional, but of course there's this interpretive piece to it nonetheless. The commonplace understanding of prayer involves a connection between humans and the divine or another being or energy life force, and can be shared among and between those religious and non-religious. So the first aspect in our prayer definition of prayer was this idea that prayer involves a relationship, an expression that involves a relationship to the sacred. So then that had us unpack, well, what do we mean by the sacred? So for a lot of our participants, the sacred did involve what this sentence says, energy, life force, the divine, but for others, it wasn't necessarily. The sacred was more along the lines of what Taves called that which is special or set apart. So we tried to work in that parameter. So it was prayer being this expression, a relationship to the sacred, however that was understood. Going on with the reading, it can be considered an approach to mindfulness, meditation, and personal meaningfulness that emphasizes the individual world of the individual in relation to the external. So that movement between the internal, sometimes prayer was a very internalized self-focused expression, and sometimes it was externalizing, in the act of externalizing something that was profound or meaningful was very important. So I think I'll leave it with that, and I'm going to hand over to Sonya, and Sonya is going to talk about some of the findings I think you'll find quite interesting.
Okay, I'll just start talking. So thanks so much for having us. Thanks to Lauren, Lori, and the group for inviting us to be here today. So I'm going to talk a bit about some of the images that you see on this slide, and starting with the top left picture. And it's taken in a site, one of our field sites in London, and it captures two men praying. It's a Muslim prayer room. And this captures perhaps what might be considered quintessential prayer, individuals perhaps communicating with the divine. And yet there are layers to this story in this particular picture. And one being that this Muslim prayer room in London had taken a lot of negotiation over several years to come into being. So various conversations and negotiations between the chaplains and various groups in the hospital to make this prayer space, I guess, consistent and there, permanent. And then we were able to actually get access to the room. I think most people do have access to the room, but the day that we were visiting, there was a physician and a prayer attendee who offered to take our photographer's camera, and our photographer being Sheryl's daughter, Hannah, who's done some excellent photography for the project, into the prayer room and take this picture for us. So in this way, it's showing the hospitality, the social connections that can happen. And then also the social connections that happen within this space across the many hospital users that identify as Muslim, who use this place on Friday for Friday prayers. And one of our Muslim administrators said, it's Friday prayer. They want to pray. Everyone comes, clinical, non-clinical patients, cooking, cleaning, people from the neighborhood. So it wasn't just the hospital users themselves. It was also those people within the surrounding communities, because it happened to be the closest place for Friday prayers for them. And then to the right of that picture, there's a picture of an indoor garden. And so prayer was also expressed in non-religious ways, which might involve sitting in some of the indoor gardens that we saw at our field sites, as well as outdoor community gardens and local parks nearby. Then the bottom left picture is a picture of the First Nations sacred space where Indigenous ceremonies took place. And this was such a beautiful room, such a peaceful room. And it included both elements of the land, such as stones, plant life, seashells on the windowsill, to artistic objects such as prayer ribbons and artwork, for example, of a sea otter, and then special objects for serving tea. And then the bottom right is a picture of some of the art that our participants did with people. And there were art-based expressions of prayer. So art in the clinical setting could lift the spirit and become a way in which to experience the clinical space differently. Gathering to hear or watch a performance which can alter one inwardly. So prayer was also described as presence. We talk a bit about this in chapter 6 within the various clinical contexts. We often assume, or it often can be assumed, that prayer is relegated to palliative care or perhaps hospice care, but it happens across clinical settings, such as critical care. So being present in a crisis, and chaplains and healthcare professionals being ready, they're reading the situation for a way that they can respond. Then, of course, palliative, the presence of accompanying and companioning and listening and sharing the silence that can happen in those spaces. It also happened in long-term care. So presence as remembering, and prayer could help in this way with those who were suffering from dementia. And mental health, there was the presence of prayer insofar as it could help to connect. So helping those to feel connected to something within or beyond themselves. And then street clinics, where the presence of prayer could be I guess a social presence to counter social exclusion experienced, whether because of substance abuse, racialization, sexual identity, or other forms of structural vulnerability. And so that's, I guess, captures some of the relational aspects of prayer. But all were avenues to transcend present circumstances or to externalize one's troubles, sometimes to seek deeper meaning, whether that was to encounter the divine, however that may be understood. And one of, I think, the lovely ways of talking about prayer, I'm sure you've all heard of Elizabeth Dresser's work, sociologist who's done a lot of work on non-religion, and she defined, and thinking about prayer, has defined it as contingent vulnerability. The concept of contingent vulnerability in relation to prayer is what sets prayer apart. It is the idea that people engage in prayer because of its ability to express something more than surface concern. Saying you will pray for someone reflects a deeper level of concern than saying, I'm thinking of you. When you say you are praying for someone, Dresser argues that this reflects the idea that your sense of security, safety, and health is connected to mine, at least emotionally. And we write a bit about that on page 139. Next slide. We also found, and I guess throughout the project, we had a blog, and it was great because it helped our thinking as a research team and what we were discovering along the way in terms of the research process. So one of the things about prayer is also that prayer is social and political, responding to crisis and suffering. During some of the field work conducted in 2017, there was the London Westminster Bridge attack, and one of our research team members had to leave quickly to be available at the hospital to offer prayer. So these larger events can intervene. And then hopefully prayer intervenes in response. So prayer requests also were a place, I think, in which we could see that prayer could be political, in the sense that people putting forward requests for prayer, whether in chapels or multi-faith spaces, to reflect current concerns, whether about employment, immigration, getting an education, and so forth. And also prayer could be contentious. It can also be contentious to acknowledge prayer in the context of public discourses around secularism. Prayer could also be harmful. So one of our participants says, "No, don't push that on me." Some just want to be heard, some just want to be listened to. They don't want prayer. And also prayer can be associated with a troubling, I guess, past with religion. So this window, what do we learn about religion in the public sphere through this project on prayer? And as we would,
sorry to jump in and interrupt. I just wanted to draw attention to the time, so we can leave as much time for discussion as possible. So please continue.
Yeah,
more.
Definitely. 3 more sentences. And so, as we would expect in secular societies, religion enters through individuals more so than institutions per se, and this makes things quite complicated given the diversity of our cities. And as one of our healthcare professionals said, it's often the case that in one room there are 4 beds, 4 residents, 4 religions, 4 languages. So the intimacy of diversity and all that entails. And so the project showed a range of expressions which are understood against the complex background of history, gender, race, class, sexualities, and public discourse.
Excellent. Thank you very much. And apologies again for the time interruption. I always say there's no polite way to interrupt on Zoom. You kind of just, your voice just appears if you jump in there. So yeah, thank you very much for your presentation. That was excellent to hear more about the project, and especially enjoy listening to the kind of methods you used and seeing all those images. It was great. So we'll now jump into the discussion and Q&A part of the webinar. So again, if you have a question or comment you would like to make, please just indicate so by typing in the chat box, and I will call on you to unmute your microphone. Sorry, and we will first go to Corey. Thanks, Corey.
Thank you, Sheryl and Sonya, for that. That was really interesting. I just have a general question about sort of the dominance of non-religion that you mentioned at the beginning, Sheryl, about how non-religion is sort of dominant through science and medicine, and it's kind of marginalized through spiritual care. Did you see a large percentage of people who generally identify as non-religious requesting spiritual care or embracing prayer throughout the project, or was it rather limited in that sense?
Yes, Sonya and I were chatting about that this morning. Thanks, Corey. Nice to see you here. There's a degree to which our project hits this problematic of self-selection as to who came forward and wanted to be part of the project. So I think if you look at our demographic table, the percentage of people who non-identify as non-religious in Vancouver overall is at 41% is what the estimates are. The number in our study is much lower than that. So we had 14 out of 109. So we're sitting around just over 10% of our study. So that's the self-selection at play, I think, is about who is speaking. So we have got a second, so those are our primary. We don't have primary sources in the sense, as many as we'd have liked, because they just weren't coming forward to speak to us. So we have this sense of secondary stories where our patients, where our staff, our administrators, and our chaplains spoke about care for the non-religious. And so we feel that there is a strong portrayal of that, the flows, the dynamics at play. The chaplaincy, field of chaplaincy has used to be called pastoral care, right? So that would have been 20, 30 years ago, it was called pastoral care. In fact, I have a picture from the one site where their old sign was still up and it said pastoral care and spiritual care, something like that. So pastoral care, obviously very closely tied to the religious traditions and origins of chaplaincy. Then the next sort of chapter of chaplaincy services was really to go to a very, what they themselves refer to, and in the chapter, or chapters, I think it's chapter 5, wrote about generic spiritual care, where they said, well, we need to really open this up and say that any chaplain can provide spiritual care to anybody. So it's saying we don't want to get into the particularities, that there's a generic level at which we can tend to somebody's spiritual suffering, if that's what it is, they're suffering generally, so that anybody who has been trained as a chaplain can care for anyone. And then now I would say in the last 5 years, there's been some movement away from a 100% generic spirituality model to add on and say we're spiritual and multi-faith care. And so recognizing that for some of the diasporic religions, it would be important to have, let's say, prayers offered by somebody who shared your faith tradition. So we see this ebb and flow, but then, so you could say that in the era of generic, so I think the question, Corey, that you're making me think of is, in that model of generic spiritual care, can we say that chaplains are kind of a bellwether? Can we learn something from chaplains? Have they actually figured something out about how to do basic human connection? Like, do chaplains actually have some of the answer for us in society about how to yes, care for people with specific religious identities, care for people that would identify as non-religious? But so we sort of landed to say there probably are some lessons of this basic human connection that we see as chaplains stepped into these relationships. And so what lessons can we take from that more broadly as far as diversity? So I think there's we're just starting another project looking at, with a similar team, hospital setting in Vancouver, looking at arts-based spiritualities. And I think that might get us, and the person there that, she wasn't lead chaplain when we were doing the research, but she's taken to a lot of what they're referring to as non-religious ritual in the context of that setting. And so I think we've got lots of room to go. I think there's lots of research needed done that's more specific, teasing out to really be able to hone in on the non-religion. That was a kind of a rambling response.
No, it answered my question. Thank you for that. I appreciate it.
Okay, great. Thank you, Corey. So we now have a question from Franz, who's asking, can you speak more about the transgressive function of prayer in healthcare settings?
Sure. So yes, yeah. So Sheryl and I were also talking a bit about this earlier. So we use the concept of transgression because it helps us to think about, I think, well, firstly, one of the things when we did say that we were doing this project and had transgression in the title, one of our Christian chaplains said, well, I don't think prayer is transgressive. And also likening it to that, to how it's used in the Lord's Prayer, in the sense of it being a negative. But transgression helps us to open up, I think, the binary between, let's say, religion and the secular, private and public. So the transgressive function of prayer in healthcare settings. So one of the things that we use actually in the conclusion is the I guess the metaphorical object of the curtain. And there's tons of curtains in the hospital space because it separates different bays where people are getting treated. But some chaplains would tell us that they would be saying a prayer to a patient, and all of a sudden on the other side, a patient would hear that prayer happening and then would either start praying along, or once the chaplain had completed that time with that patient, said, can you pray for me too? So there was a way in which prayer transgressed the public space, I guess, that ward was. It didn't necessarily, it was, even though it was somewhat of a private moment because of the curtain, things seep through the materiality of the curtain. There's a sonic element to that prayer that's happening within that very public / private space. So in that way, prayer is transgressing. Prayer is being transgressive in that sense. So it's transforming that space into somewhat of a sacred space. So I guess transgression was helpful for us to disrupt some of these binaries between informal, formal, public, private, sacred, secular. It blurs and shows in some ways the fluidity of prayer, whether it happens spontaneously on the elevator as someone's going to surgery, and in a hospital mess, or a humanist pamphlet in the very Christian chapel space. So there's ways in which these different prayer practices are transgressing. So it's a way to see how things are transformed and disrupted. And sometimes it could be solidify boundaries too, and solidify differences. Yeah. I hope that helps. Hope that answers.
Thank you. Thank you.
Awesome, thank you. So we'll now go to Linda, who also has a question.
Hey, Sonya and Sheryl, lovely to see you. And thanks for that. It was lovely to hear that. Really enjoyed that. My question's about another sort of transgression, which is, you know, there have been lots of legal cases where people have objected to being prayed for, and it's seen as proselytizing, and you know, it's kind of weaponized, the whole debate, and there have been legal actions on both sides. Has that made it, you know, if you're going to pray, you've got to be very cautious and make sure you've got the full consent of the person you're praying for? And if that's the case, then if you're not brought up in a religious tradition where there is prayer, would you ever think to ask for it? Or how does it work if consents are taken really seriously? Or was this just, are these just media stories and it doesn't really have much reality on the ground?
Yeah, that's great. We exactly, this story of the one of the stories in the media, the praying nurse in Britain, is what she was ended up being labeled as. Is just one of the stories. We found even the chaplains in this study were actually incredibly cautious about offering prayer. It would be many visits in before they would offer prayer. Often, and like not often, it would be many visits in. Sometimes they would be in the crisis moment, but they, in both Britain and Canada use the phraseology around person-centeredness. So that's person-centeredness is really gaining traction in healthcare systems. And so that was orienting for them to be able to say, what is it that the person is looking for? So I was actually surprised at how cautious they were. Now, the exceptions, here's the interesting part, is the exceptions. There was one staff member who said, and she wasn't, she was a physiotherapist, and she said, I straight up offer prayer to everybody. That was shocking when she said that. So she found a way of doing that, but my hunch is that there was resistance from time to time. So there were places that prayer was affrontive, right? So that would be an example where it was affrontive. For the most part, we found that it was actually treated itself as something set apart. Like, so it was treated with quite a bit of care. So that was kind of a relief. What do you think, Sonya? Other stories from London?
I was just trying to think. I had a train of thought, and then I just lost it. What was I going to say?
I think I'll just, while you're gathering your thought there. So where people had designated on their admission records what their religion was, it tended to cue that faith leader or that chaplain of that group. So the Catholic priest in Vancouver would go see, in essence, his parish who was in the hospital. And so he would go from bedside to bedside. Sonia, I think that's, and we saw that quite a bit in London too.
Yes.
So the second part of my question was, so if you're a non-religious person who gets your connection in nature, say, are you going to just miss out completely on this service?
Well, and that's that was part of our question, is what support do they get? So then do they get a different kind of support? So that's where the challenge of then finding what is meaningful and what is the equivalent. What's the equivalent of prayer?
So on one of the admissions forms that we saw from one of our sites, they asked the question of what religion are you? And it just says religion, black and white, and a square beside it. But there's no space for non-religion. So I think it's just, what religion are you? It's just religion, fill in the box religion. And so I think the non-religious, they're growing, but they become invisible within, I think, the hospital system in a way, if that's not being asked on the admissions form. So you're right. How are their needs being met? And chaplains did ask outright, how do we provide for the non-religious? And certainly some administrators were saying, well, how do I get time if I don't have a faith, or if I just want that time? And then also, what about beautiful, sacred, meditative spaces that aren't religious, but where I could, gain sustenance throughout my day? So I think it's something that has to be worked on, and they probably already are, hopefully. But I guess maybe, the pandemic obviously has taken over, but it's something to be addressed.
Thank you.
Great. We'll now go to Ali, who has a question.
Hello, I don't think you know me. My name's Ali. I work with Dr. Emily Barras and Andy Paris. So I'm at the University of Guelph. I was just wondering, I come from a background in recreation therapy, and I was wondering if you came across any recreation in your studies, because a lot of the things you talked about in the book, like music as therapy, or horticulture, like we'll do gardening and things like that. What was your experience? Did you have any experience with recreation and spirituality?
Yes, fantastic. I'm just flipping through I don't think we actually had any participants who were, I don't have them listed out in the healthcare profession. Okay, especially in our long-term care setting. So of our sites in Canada, especially in Vancouver, we had long-term care settings, and absolutely music. We were there. They were doing I think is that it was characterized as a very important part of the well-being of the residents in long-term care settings. Also, so the chaplains in those settings often worked very closely together with the rec therapy, partly because they were kind of like the non-clinical staff in a sense. They weren't doing the personal physical care, but so there was a natural affinity in the kind of work that they did, and they talked about handing back and forth who's running this session, so they were back and forth. In the hospital setting on an urban health unit, we also had a lot of art therapy. So that's where we'll probably start up with this idea of an art therapy, art-based spirituality. So the picture that we had on the slide of the paintings, that was in a sense, it was an activity, but it was led by the chaplain in that case, which was so interesting. So he brought people into the art room and hung out with them while they were doing art and basically talked about how they were doing. So that was, so you're right in that there is close overlap when you're thinking about the well-being of somebody and where does this fit together.
Great, thank you.
Hey, thank you, Ali, for your question and welcome as well. So I now have a question from Amelie. She is asking, could you elaborate on how and why you decided to ask chaplains to keep diaries and the benefit of that method?
Sonya, you want to go ahead?
Good question. I think sometimes words, at least spoken out loud, might only capture so much. So the semi-structured interview. So research diaries did enable us to receive from chaplain participants some of their own reflections on prayer that might occur or that had occurred, that we, I guess, didn't always gather in the interviews themselves. So it was another way of collecting their thoughts, reflections, the ways in which they went about praying for others or others asking for prayer. Yeah, I guess it was to add to the richness of the data collection. And yeah, I guess it's getting at that reflective piece. I mean, certainly reading some of the diaries, we had chaplains talk about creative. We actually had one chaplain write a poem, and I don't think we would have gotten that poem if we just from an interview itself. And it really captured his experience of being a chaplain. So it was, in some ways, the research diary opened up, could access other things from the participants themselves. I mean, not everyone contributed diary reflections. So in this, the downside of that particular method is that it could be perceived as another piece of work for the research project. We certainly got, I think, one or two entries, but not everyone participated the full way. So it could be difficult to gather the research diaries because of the effort, I think, seen to be involved versus 2 interviews, the walking interview and the first and actually the last interview. So there were 3 interviews that they did for us, the chaplains. Whereas a diary, you might be at the end of your day and it's the last thing you want to do. So there's upsides and downsides of the method.
Thanks.
Thank you.
Great, thank you. Yeah, does anyone else have a question or comment right now? And we have another one from Franz who asks, did you reference studies on the clinical did you reference studies on the clinical efficiency of intercessory prayer that were popular some days ago.
Yeah.
Decades
Yep.
ago. Sorry,
Great.
my pronunciation, that one was a little hard.
Yeah, we set out pretty quick right at the beginning that this project was not about trying to measure if prayer accomplished something. It wasn't that kind of study, but we do have some reference to that, just to sort of acknowledge that that's not what we're doing. So we've acknowledged some of those studies. I guess there was quite an effort made, right, to make a case for prayer in a sense, and that we need to show the direct health benefits of prayer. So we stayed away from that. That wasn't our approach to the study. We really wanted to use prayer as sort of like this heuristic idea of helping us to understand something more deeply. So yeah, so we did have, I would say that some of our participants thought that's where we were going, and they were ready to tell us about that, but that wasn't the focus of the study.
Thank you.
Awesome, thank you for that question. Okay, so I have a question. I'll go to mine now. I was just curious if you could talk a little bit more about some of the differences you saw between each of the field sites that you had kind of indicated during your presentation, Sheryl.
Right. Maybe I'll say a little bit about Sonya's referenced some of the differences in clinical sites. So I'm going to say a little bit about, again, the type of healthcare service it was providing. And Sonya, maybe we can build out a little bit more between London and Canada and Vancouver. You know, the chaplains most often are in acute care settings, and meaning hospitals, and they've tended, and within the hospital context, they have had highest, they talk about ratios of chaplains to patients, and so the highest ratios are always in palliative. And so there's a bit of an assumption there, isn't there, that people towards the end of life are going to somehow need chaplains more. So that's an interesting assumption. So they're focused in those areas, and that was the same in London and in Vancouver, was this focus in those areas of palliative and in crisis, so acute, especially intensive care. So that is where the services are focused. The street clinics was the interesting part for us, because that in Vancouver, the street clinic was access to a safe injection site is what the street clinic was in Vancouver. And in London, it's a sexual health clinic. And so that was very interesting. The spiritual care services looked very different there. And they were really, I would say, they were just part of the mix of psychosocial care. And it happened to be provided by chaplains stepping into that kind of psychosocial care. So there is variation as to the type of setting between Vancouver and London. Vancouver definitely had this strong attention to, so obviously any of the Canadian settings had this attention to Indigenous spiritualities, and that was and continues to be a real point of needing peace to work out. So the reconciliation process is about all of us in Canada, right? So, and chaplains are right in the mix of that, and being affiliated with a faith background, usually for chaplains, even if they're working in a healthcare system, the work of reconciliation is not easy. It was really, and yet is so life-giving when it grabs and takes hold and starts to have the transformation that comes with reconciliation. It's amazing. So we have some very cool examples, but that I would say looked very different in Vancouver. So there was a lot of attention being given to that, and there was a attention and a lot of tension around that, just craziness. And Sonya, I don't know what you would say would be the equivalent in London, maybe the Muslim prayer room. I mean, that's a contrast we use in the book.
Yeah, it's chapter 3, mapping geographies of prayer. We offer those 2 case studies, one of the Muslim prayer room and one of the First Nations prayer room, and how in different ways there's those histories of colonialism, the racialization of space, who gets to use what room, who gets space, who doesn't. So those questions of power relations there. So certainly in terms of looking at the two sites, yes, those would be similar but different. And then also just thinking about London and Vancouver as cities themselves. I mean, and Sheryl alluded to this earlier, but I think the one thing that struck us was Vancouver being very much, it's nature, it's the ocean, it's the mountains. And that's very much a part of the spirituality that one might experience, the reverential natural wisdom, I think that Paul Bramadet talks about. And then also in London, it's the arts, it's culture, it's the galleries, it's the classical concerts at lunch at your local church, if you're near one in the city that does that. I mean, there's also the Thames, there's great parks in London, but there's something about Vancouver's setting that offers it nature in a different way that becomes much more a part of, I think, your everyday in a way. And so I guess, and arts being at one of the hospitals, it was very much present in one of the hospitals that we studied, art, sculpture, weekly performances, classical, Indian dance, classical quartets. It was just, you could go into that public space of the hospital and get your cultural fill for the week, if that's, if that's as far as you could get. So those are two, I guess, striking ways in which the cities then informed the religiosity and the prayer of people in those spaces.
Fantastic, thank you. So we just have a minute or two left, so I will just conclude briefly then by thanking all our participants for being here and all of your awesome questions. And of course, thank you very much, Sonya and Sheryl, for joining us today. This was fantastic. It was a great discussion, and your presentations were awesome as well. So thank you very much again. And with that, I'll say, I hope everyone has a great rest of their day.
Thanks, everyone,
for the conversation. Yeah.